Alrighty, welcome everyone. Thank you so much for joining us today. As a reminder, we have you all muted for the initial briefing, and once the briefing is finished, we will be taking questions. You can either use the Zoom application to raise your hand to ask a question verbally, or at any time you can type your name into the chat box and we'll also ask your question that way. And if you've called in by phone, you can use your dial pad by pressing *9 to raise your hand. That way we can unmute you so that you can ask your question. In addition, please make sure to identify yourself with your full name and the organization or media outlet you are calling from prior to asking your questions. And with that, I'll turn it over to County Manager Mike Callagy.
Happy Friday, everyone. Thanks for being with us for the Friday, April 10th briefing. I'll start like I usually start with the numbers. The cases confirmed 638 today as opposed to 633 on Thursday. We don't know, I mean, that's obviously one of the smallest differences we have had. We don't know if that's because of backlog in testing or people slowing down on the testing. We do know that the testing has been slower at Fairleigh, that we don't have as many people coming through. They're closing early. And I'll talk a little bit about that in a minute and how maybe all of you can help us get the word out and different ways we have of getting folks there. We're holding at 21 deaths, which is good news that we don't have to report any more deaths if there is any good news associated with this. And then we have about 80 people under surveillance right now. Ellie, thanks for pulling up the slides here so you can see our graphs here. If we go to the next one, where we are indicating that surge amount, we still have 77%, which is great. We've used a little bit more in the ICU beds. We got 35% available, and then 75% of the ventilators available, which is great. 86 people in the hospital right now with COVID-19. We have moved some of the beds out of the event center into local hospitals to create more capacity within the hospital so we don't have to bring resources to there. Obviously, it's better to consolidate those resources as far as medical personnel rather than having to bring them outside the hospital and recreate that situation at the event center. But we still do have a lot of surge space at the event center in our hotels, so all that is good news. We do have a new slide to show you, and again, we're trying to refine this and trying to give you as much information as we can. The other day, we had a question about total patients tested so far, almost about 6,000 in this county. You can see the positive results, you can see the positive percentage, the negatives, the pending results, and the average day right now is 2.2. We're hoping that as they clear the backlog, the initial backlog, that will get better over time. We're a little worried about this weekend because we've done such a great job of shelter in place. We are, concerned that the people are getting antsy, and it's supposed to be a really nice weekend. And a lot of folks are out of school and home, and we're worried about people not adhering to those orders. And it's so important to us. We need to double down now because this is a critical point in what we've done. A lot of people have really sacrificed to stay at home. And by doing so, they are literally saving the lives of others. And we encourage people to continue to do that. We want to note that there's no access to the beaches. The parking lots are closed. We are trying to get messages out there and have Caltrans help us get that message out there, to really reinforce to people to stay at home, save lives, in the COVID-19, just that reminder. So we will be working on that. Just to note that Mid-Peninsula Open Space has closed their parks for the county on weekends. It was at the request of the health officer. Mid-Pen again has closed their parks in San Mateo County on weekends to help make sure that people try to stay in shelter in place. The personal protective equipment, we just are so appreciative to all those entities that have pitched in. I mean, everywhere from schools to biotech to I think we even got some from tattoo parlors, that gloves and things. So I think everyone's really come forward and really really donated a lot to get us through this interim period here where we had this shortage. And, we still continue to accept those donations. We got a little ways to go before we get some more stuff in. But next week, we should be getting 1 million of the N95 masks in. And, we've ordered 3 million of them. So we should have 1 million coming in next week. And then in the next couple of weeks, the arrival of the needed supplies. So we're very much looking forward to that. And for those vendors who, we got a lot of tips on vendors out there that we had to vet, some fraudulent, some not. I mean, some are great vendors who really have become our supply chain for us. But we are encouraging anyone else that wants to try to be part of that purchasing process to go to a public purchase website for San Mateo County. Excuse me, Ellie, maybe you can bring that up and show that. So we've got that there. For anyone, if you want to help us get the word out on that, that's great. We're really working the health updates, or they continue to work with the 6 hospital partners in our county on preparing for the surge. In addition to working with our hospital partners and our senior living facilities and everyone else on the PPEs that they may need. So earlier this week, we endeavored to really reach every corner of the county with transportation to testing. We have achieved that. You want to show? I mean, these vehicles are really old vehicles that we were going to replace, and we've done a good job of converting them. We put the shield in there for the driver. We've got a passenger seat in the back. We've worked with Verily, so now we can go to every corner of the county and pick people up if they do not have a ride to get tested. And we've got a number, and you can help us get this number out there if you can, at 650-779-9375. During normal operational hours, we will get people to the site if they can't get there on their own. And we're hoping that this is really where you can help us. Obviously, there's not many people getting tested right now, and it may be a couple of different things at play here. One is that the criteria may be too high, and we've asked the governor's office to take a look at that, especially in regard to essential services workers. We want them to be able to get through on demand. So we're asking the governor's office to loosen that, and then to also loosen the criteria that's necessary to get people tested. So we want to get those lines flowing. We want to make sure we get more people tested. And to that end, we have created this system where we will go pick people up. If you call us in advance, once you get your appointment, we will schedule you with enough time to get out to pick you up. We've got 3 vehicles that are ready to go. We have them staffed as needed. And we would encourage people to avail themselves of this service if they cannot drive here on their own. It's a free service. We will pick them up. We will get them tested, and then we'll get them back home. So we had a question before of our CPS cases up, and the answer to that is no. It's just the opposite. They're down 44%, and a lot of that has to do with the mandated reporters that we see in schools that report a lot of suspected child abuse, and then we go out and investigate. Well, here obviously schools are closed, so it may not be a good thing that we don't have those eyes on the kids, and with kids sheltered in place, we wouldn't have the opportunity to really know if they were being abused or not, as if they would if they were out in the public with mandatory reporters spotting them. So it is not us. It is really across the board that we're seeing this. It's on a local, regional, and statewide, and really a national issue more than just a local issue. But we wanted to get that information out there that people were asking if we saw an increase, and it's just the opposite right now for the reasons I just articulated. Some of the questions that have been generated in regard to the media questions. Santa Clara and other counties are starting to list the case data by city and ethnicity. Does SMC have plans to do this? The answer to that on the city side is no, but we are going to ask our health official to look at that again. But on ethnicity, yes, we hope to do that. We've got modeling that we believe will be ready on Monday, specific to our county. As you can see Ellie, if you want to pull up the, you know, what one model out there says about the state as a whole right now, you can see that, you know, the shelter in place appears to be working. We have really flattened that surge time, but we prolonged it. And that's what we expected to do with shelter in place. And that's why it's so important right now. And again, I don't want to put, you know, say that this is the end all, but I know that this is certainly one of the models out there, and you can really look at it by state. It's one of the models out there that you can look at and see. And we want one specific to our county. At least this one here, looking at the state as a whole, and that's specific to counties or region, says that, or seems to say that there will be enough beds, enough ICU beds, and enough ventilators for when that surge hits, and it has it as April 13th, I believe. And that has moved down precipitously with time, because I believe the shelter in place is working, and that is why it's so important, especially this weekend, people stay in place. By Monday, we should have our own model specific to this county, and we will be sharing that information with you as we receive it. Next question, examples of conditions that must be met before the SIP lifted, including robust hospital capacity, sustained reduction in cases, testing requirements, etc. Does SMC have plans to create and release similar goals as a way to let people know when this might happen? You know, these are all important goals, and you know, looking at those more as information, we need to evaluate whether to extend the shelter order. But the primary reason for the shelter in place is really to curtail the community spread of this. So I mean, there's a lot of things that that are important to consider here. You know, just because we get over that surge point, wherever that may be for this county, and we should find out when that is, doesn't mean that the disease certainly can't be spread. And we want to, you know, safeguard against a situation where we reopen and just get more people infected, and we have to shut down in the near future again. So we want to be cautious in the way we approach this. We want to be strategic in the way we approach this. I think I mentioned before, we've hired IEM to work with our folks here to really develop a plan on what makes sense and what are some of those essential services that we can look at and say, you know, society really needs. So maybe we start here with these type of things and lose them. You know, there's other interesting work going on in antibody field to determine, you know, those who may be immune to the disease because they caught it and didn't realize it. We know that probably somewhere between 30 and 50% of the population maybe is asymptomatic. You know, had it, didn't know it, and that's when that important. That's why that important that testing will become more important in the future, and maybe that will give us a path forward as that information becomes more widely spread and those tests become more widely available. We know that Stanford is engaged in that now, and I think you've all seen some of those results or some of that information that Stanford is doing that testing. So there may be many paths forward, and we don't have one path forward right now. But a lot of that, you know, a lot of those things are to consider. You know, if you have a good percentage, or you have a good idea of how much of the population is immune, and how much space you have in the hospital and ICU beds and ventilators, and how prepared you are, you know, that certainly may be factors that come into play. Is testing at the event center still low? Do you have specific numbers for the past week? Any data showing similar from other testing sites? You know, those are good questions. And the event center is low. Again, they closed at 11:30 today, and that's why we're hoping for you to help us get the word out that there is this opportunity to get tested. We really think that it's in part twofold, like I mentioned before, that social distancing is working, that maybe people don't have those symptoms. And that is the underlying really objective of what we're trying to do here with sheltering in place. The other thing is we believe that maybe the bar is too high, and that needs to be adjusted. And again, that's why we've asked the governor's office to really look into this and see what they can do. And then the third problem might be that maybe there's not enough test kits available to really do the masses the way we want them done. We want on-demand testing for essential services workers, and it's anyone working in a grocery store, a pharmacy, a senior residential care facility. All those should be tested on demand, we believe, because they are super commuters of this disease, and we want to make sure that that they aren't out there in our grocery store interacting with our folks, or in obviously a residential care facility for seniors. Number 4, we've taken care of any progress on listing a number of recoveries from the total numbers. Well, I think that we can show that, here that we can extrapolate some information. We have positive test results. We've got the vast majority of those that are recovering. Maybe we can get more specific. The problem is I don't think we really have a mechanism in place, and correct me if I'm wrong, Peter, to really follow up with folks and ask them how they're doing, once they've tested positive. Obviously, we do know, unfortunately, they pass away, but not the exact date that they recovered or they're back active in society. But I think that'd be pretty hard to track down. I would say that the vast majority of people do recover, obviously, from the if you look at the deaths in relationship to those who have tested positive in this county over time. So I think you can probably just by indication here, say that the vast majority do recover, and we don't know the exact date, time. I think it's, or how long it takes them to recover. The state peak is estimated to be next week. Are we following the same estimate? I think I talked about this a little bit. Yeah, we talked about this as far as April 13th. We will know more on Monday. We will know, hopefully, more specifics again about this. But then again, these are just modeling numbers. They are the best work of those in the field. They can change dramatically over time. And, it gives us a snapshot in time that we'll continue to try to use to help us. Again, the most useful part of it is when we can determine surge and capacity and get ready for that. And then, when will it dissipate enough to the point where we can open up and start the society, activities again that we're all used to. And then again, what and how strategically we start to do that. So we will know more about that as time goes on, and certainly keep you informed. With that, Ellie, is there any questions?
Yes, Henrietta, you've been unmuted.
Yes, thank you. Governor Newsom announced today that the state is working to house emergency workers, nurses, firemen, police who live out of the area. Is the county working with the state on any San Mateo County workers, or has the county set up its own program?
Yeah, well, absolutely. I mean, and I'm glad that the governor agrees with us, because we started this several weeks ago. In fact, at the inception of this, we recognized that healthcare workers and first responders may need hotel rooms because they're working long hours. We negotiated those contracts. We have those available, and it's good to hear that we will get reimbursed for those now. And I'm just also proud of this team here. They've been tracking from the beginning. It's a well-oiled machine as far as FEMA reimbursement, and I believe that we're one of the top 10 in the nation, probably the first in California to submit for reimbursement. We're very, very high up the list. Like I said, I think we're number 7 federally on the list. So I mean, I think that's just a credit to the men and women here working on the ground floor in the EOC, who are keeping track of every single taxpayer dollar that we're spending on this.
Great. Next question is from Margie Schaefer. You've been unmuted.
Oh, hi, good afternoon. I'm with KCBS, and I'm wondering, you specifically talked about loosening the criteria for the testing. The bar's too high. What's too high? What would you want to see loosened? What are they asking for now that's too much?
Yeah, I think that let's start with essential services workers. I think that there's a requirement that there'd be one symptom and potentially some exposure. We'd like to see essential services workers on demand, that there's regular testing of them. They certainly have the capacity right now to do that. So we want on demand, if there's an exposure, if they simply believe that they've been exposed, or even preventative testing. Maybe we should be rotating them through in the grocery stores and so on to make sure that they don't have it. And maybe we should be testing all those folks. But we need a streamlined process so they're not waiting days or 2 days to get in, and they've got to show a sign. So on that side, you know, it should be based on just regular checkups or on exposure or suspected exposure. Now, on the other side, on the public side, I believe that you have to show 2 symptoms. We're asking that it be reduced to potentially 1 symptom. So instead of a cough and a scratchy throat or a cough and a headache, it would be reduced to 1 of those, just so we can get more people in there. And eventually, you know, it'd be great if we got to the point of on-demand testing, and we hope that maybe if we get to antibody testing, that will be the case in regard to that, where folks can sign up and get through and get masses through in large quantities will give us a better idea of who might be immune in society in San Mateo County and who's not. Those numbers will help us determine how to go about reopening a society, particularly San Mateo County someday.
Thank you.
And just as a reminder for those on the phone, if you'd like to ask a question, you can press the participant icon at the bottom of your screen. A window will pop up and there's a button that says raise your hand. That way we know to unmute you. For those calling in on the phone, you can dial *9 to raise your hand and we'll know to unmute you then. You can also enter questions through the group chat. And at this point, we'll go back to raised hand from Henrietta Burrows, EPA Today. You've been unmuted.
Thank you. Going back to my original question, how much is the county paying to house the emergency workers, and what type of reimbursement are you seeking from the state?
Well, we'd love to get 100% reimbursement, and I do not know because we've negotiated different contracts with different hotels, and I'd have to check into that, and we could certainly have that information for Monday. But we did it early on because we recognize this, and you know, not to say that we can negotiate. You know, we certainly can negotiate contracts daily because the price continues to drop daily, right? Because there's so much capacity out there for hotels. Not many locations want to house those who are COVID-19 positive, but we have secured some of those, a large quantity of those rooms in the county. But everyone would be certainly willing to house first responders, you know, at a discounted rate, and I can find what that rate is for you. But we've been, you know, offering that up for several weeks now, if not a month, and they can come through the county EOC with a request, and we would take care of them on that. And then for FEMA, it's usually, I think, 75% reimbursement. I think they pay you 50% up front and then another 25 later. But we're hoping to get full reimbursement from the state.
Thank you.
Next question is from John with the Daily Journal. What is the current criteria for testing? And then how would you like the criteria to be changed? And is the testing free?
The testing is free. And again, we'd just like them to reduce the standards. So if I believe that right now as it stands, Peter, correct me if I'm wrong, it's two requirements. I think it's 2 requirements that are 2 symptoms that you have for the public. And I think it's 1 symptom for first responders and essential services workers plus potential exposure. I think that we should do on-demand testing of essential services workers. We should take people through there and reduce that requirement of, you know, if there's this expected exposure, maybe that's okay. But even you know, less than that, I think we should do it on a random basis to test people. These are the folks that are in our stores, stocking our shelves, and you know, cashiers and working in pharmacies, and police officers are going into houses, and firemen who are showing up on medical calls, and all the health staff not only taking care of COVID-19 patients, but those who have heart attacks and strokes and everything else. And these are those super spreaders, and potentially, and I think it would be prudent for us to be able to test them, you know, on a regular basis and be able to get them in on demand.
Great. Next question is from Emily with the Daily Post. Are any of the 97 surge beds currently in use at the event center?
At the event center, we had 250 beds, and we removed, I think, 125 of them and put them in the hospital, in the hospitals around the county, just to create surge space within the hospitals because of the staff that we know is already there. And that is the most critical part. We can put as many beds in this county as we want, but it's really the staff that is critical. And so we have still another 125 beds at the event center that we would staff if we had to. And they are vacant right now, so we have no one there. We do at one of our hotels have, I think, 14 patients there. They've been stepped down out of the hospitals to create capacity within the hospitals, especially out of the ICU units or into a step down type of medical care where we have full medical personnel at these locations and taking care of them. They just don't need the level of care that a hospital would provide, but they're still positive and they can't go home and they still need treatment.
Great. So just a reminder, if there's any final questions, you can go ahead and enter them into the chat box or click the participant icon at the bottom of your screen. Window will pop up where you can raise your hand, click raise your hand button. And it might be those three little dots that you click at the bottom of that window where it says raise hand. But if there are no other questions.
Great. Everyone have a great weekend. Hopefully you get out, but stay within 5 miles of your home and really enjoy this weekend. Stay healthy and stay safe. And we'll talk to you next week. Thank you very much.